Very good morning to all of you. I think Professor Ayman has provided a good stage for me, when he talked about pharmacy education for the 21st century. I come from a practice background, working in a hospital, and certainly, pharmacy education has continued to evolve. There are many challenges in healthcare, as mentioned by you. And that includes, obviously, demographic changes, healthcare models, new drugs that come into the market, and therefore, how pharmacists practice, in the practice area makes a great difference, and that is actually a continuum of education. So my presentation today is about factors that influence the effectiveness of pre-registration pharmacist training in a tertiary hospital, and that's my hospital in Singapore General Hospital, the views of preceptors and trainees. The outline of my presentation will cover the background of pre-registration training in Singapore and in my hospital, the objectives of my study, the methods, results and discussion, conclusion and future work. As a background, pre-registration training prior to licensure is an important continuum of education from classroom teaching as an undergraduate to real-world practice. Therefore, effective training is critical in order to prepare pharmacy graduates ready for independent professional practice. This is the first study of its kind conducted in my hospital, the Singapore General, and also locally in Singapore, to seek opinions from stakeholder groups, the graduate trainees, and our preceptors to better understand the key issues of pre-registration training. As a form of background, at a national level, 1 year pre-registration training is a regulatory requirement under our Pharmacist Registration Act 2007. Typically, this is conducted 1 year post-graduation. In 1997, we had 3 months in-course and post-course 9 months of the training. And going forward in 2017, the pre-registration training will be done 6 months in-course during their undergraduate days and 6 months post-course. With this as a backdrop, you can see that we will need to adjust our training. In any case, the new training modules from 2017 onwards will involve 4 rotations in 1 year, so that would mean 3 months, and 2 of which are compulsory, and that is in acute care as in a hospital, community care as in, you call them community pharmacy or retail pharmacy environment, and then the other non-core components can be indirect patient care, such as regulatory affairs, manufacturing, the pharmaceutical industry, or primary care, and another posting would be in ambulatory care or specialty centers. As mentioned earlier, the 2 rotations of 3 months will be done in course and 2 rotations post-course. So in preparation for this, my hospital, which had previously been providing, if you can see under previous model, the 9 months training post-course, we have our trainees rotate through different sections of the hospital, all right, and because of this new program, we plan to then revamp our training model, and we will be providing 2 rotations, one in acute care and the other in ambulatory care, both 3 months each. So the objectives of my study, right, is to examine preceptors and trainees' perceptions on the factors that influence the effectiveness of pre-registration training, and then to identify areas for improvement and to develop the strategies to enhance our current training program and learning experiences for our trainees. Methods. We started off with 2 focus groups, one each with preceptor and the other with the trainees. They were held separately to gather opinions and elicit elements for our survey questionnaire. The preceptors and trainees of the 2014 cohort were randomly selected, and for optimal discussion, the target was to have 6 to 8 of them for each session. The elements that were elicited from the groups were then grouped together under the factors training program, preceptor-trainee relationship, trainee-related factor, preceptor-related factor, and environmental-related factor. The survey questionnaire was then formulated, incorporating the elements from the focus groups, literature, and the author's personal experiences. It comprises then 50 items on an 11-point scale, and this questionnaire was then distributed to all preceptors and the trainees in the department. They were requested to rate the quality of current training based on the questionnaire items, and also the ranking on the importance of these factors that influence their pre-reg training. This is a sample of our questionnaire. So the outcome measures, as mentioned, was to look at quality rating on the factors and items associated with that influence effectiveness of the training program, and also their perceptions on the importance and impact of these factors in influencing effectiveness of training. The results in terms of response rate, from our preceptors, we had 74% response rate. The trainees, out of 2017, responded for 85% response rate, and therefore an overall response rate of 77%. These are the results. You can see on the left-hand side, arranged according to factors. Okay. The mean score in general was rated higher by the trainees compared to the preceptors. Oops. No. Okay, I'm not sure which is the pointer. No, it's okay. All right, and okay, and the score rated for preceptor-related factors was significantly different between the preceptor and the trainee under the independent t-test conducted. In terms of impact of the factors in affecting our current training, we found that the training program was ranked highest by the trainees and the preceptors. In general, our trainees have also ranked preceptor-related factors as more important than the preceptors. You can see that marked in red. The areas of strengths in our current training program, I've listed them according to the mean score of 8 and above. All right, we found that our training program has strengths in terms of its structure and clear training objectives. There were hands-on training opportunities, good variety of cases that can help to develop clinical competence. The training has also helped trainees to apply critical knowledge to real-life practice. Practice to help them to practice safely and effectively, and has met training objectives. All right, what stood out for trainee-related factors was that the trainees in general were receptive to feedback. Other areas of strength related to preceptor, they were willing to teach. They guide trainees in applying knowledge and clinical reasoning. They were inspiring role models. They were committed, supportive, and nurturing of trainees and help them to achieve their goals to gain competency. They have skills and abilities in teaching trainees, and they provide regular and timely feedback for trainees. In terms of environmental related factors, they are living role models in the workplace. All right. For areas of improvement, there were 4. If I could put them together, it's basically 2. All right. One is in the area of sufficient protected time for teaching, and the other for learning, and the other is the current workload pressure that has affected trainees and their preceptors as well. All right. In terms of perceptions on the importance of the factors in influencing effectiveness of training, the trainees ranked preceptor-trainee relationship as number 1, and the preceptors ranked the training program as the most important in terms of influencing how effective training was. Okay, this is represented in a table form. And you can see that trainees ranked the preceptor relationship as most important. In the focus groups, however, which was done earlier on, you can see that actually, it was ranked 5 as the least important, okay? So whilst we are not too sure what it is, our guess is that it's probably a conformance bias because the focus group was done as an activity together. As a conclusion, all right, the factors perceived to be important in influencing how effective pre-registration pharmacist training was. From the trainees' views, it's the preceptor-trainee relationship as rank 1. Number 2, training program. From the preceptor's views, training program is ranked first, followed by trainee-related factors. Okay, and as far as our current training is concerned, both preceptors and trainees have ranked our training program as providing the greatest impact on how effective it is. The score for our training program is 7.34, so it's considered effective. Okay, we have majority of positive responses, 48% of which are rated 8 and above. And the high scores were reported for trainees' receptivity to feedback, the preceptor's clinical competence, good communication skills, willingness to teach, and related to program, that we have good hands-on training opportunities, good variety of cases. Program is also structured and clear training objectives. Two key main concerns were protected time and workload pressure. So what's for the future? Strategies to enhance our current training program and learning experiences of our trainees. Firstly, to do with protected time. This was in discussion with our program director. As per current, actually, our trainees already have half a day per week when they can go off, all right, for their own personal time. So perhaps because they spend quite a lot of time on projects, the program director felt that we could encourage them to use their time, for reflection of their practice. The other was a protected time for preceptors. So going forward, we are going to roster them, for this protected time so that they will be able to be relieved from clinical duties and then be able to meet their trainees for their educational activities. Pertaining to workload pressure, this was an interesting discussion as well, the program director. His point was that if workload is too low, our trainees may not be able to cope with real-life situations. And so, the plan then is to scale up, right, the workload for our fresh graduates, but they will be adjusted up to what is our hospital norm. All right. Preceptors will then also be assigned 1 trainee each time, so 1-to-1 and 1 per year. All right. We'll leverage on IT and automation for pharmacy processes. Actually, we are already very much into that, so I think we'll continue to tap and leverage on that. And the fourth one, an interesting one, which I think was also mentioned by Dr. Ayman earlier on, is about innovative models of training. All right, and this is about blended methods. And in fact, the pharmacy department has in the past 2 years developed topics in the form of lectures and case studies, and then this were posted in a blackboard for the students or for the trainees, so that they can access anytime, look into them, all right, and be prepared when they come together, all right, the big group with 1 preceptor for case discussions. My concluding remarks: it is important to know about the nature of learning and professional development that takes place as a student transits to professional practice. This transition period, or what we call novice development, is a process of change within the individual in terms of knowledge, skills, thinking, all right, and as well as a contextually grounded professional socialization process. Okay. Clinical learning experiences can shape the formation of professional identity as well as development of professional competence. And this is crucial for novice practitioners as they move to increasing autonomy, responsibility, and greater accountability for patient care and patient outcomes. These are my co-authors. And with this, thank you.
So, do we have any questions?
Yeah, thank you for your presentations. Just I want to know about that because I'm very neighbor to you. I'm from Malaysia, so which I'm working in International Medical University. Regarding this preceptorships, right? You said last point 1:1. So it's including all the government hospitals or in your hospitals only?
At a national level, the ratio that the preceptor can handle would be 1:2.
1:2.
Yes.
Oh, it's very nice because of the populations again, I think so. But it's very difficult, like even in Malaysia, which we are facing, even we are handling 10 students is a 1 preceptor ratios in hospitals sometimes. And one more
so
thing.
1:1 is like, doing very well for, the preceptor. You
Yeah,
don't have
it's
to handle
national government policies again, right? Yes, because even our government says, because the students ratios, nowadays the pharmacy booming, in Malaysia, right? That's the problem we are facing really. Really the hectic, from morning to the evening, it's very hectic. And two more things I want to ask. What about the preceptor qualifications in national hospitals?
Preceptor?
In Singapore, qualifications.
Qualifications.
Yes.
The preceptors are actually all practitioners, definitely, in the setting that they're in. The two requirements that are required of them will be, one, they must have at least 3 years of working experience.
Okay.
And then number two, they would have attended the preceptor workshop.
Training workshops, right?
Yeah.
Okay. 3 years after graduations. Okay. If any institutions in your nation are running the post-graduations courses, okay, it's a post-graduation, PG, Master of Pharmacy, anything. What about their training schedules or training programs?
For what again?
For clinical postings. Post-graduation students, clinical pharmacy, post-graduation students.
Sorry, so what about that?
What about their preceptor qualifications? The same undergraduate preceptor, those who are having a 3 years experience, will train the postgraduate students?
Okay, so if it is what we have mentioned is pre-registration, that means those who are fresh graduates.
I accept this. Yeah. I readily accept.
Yeah.
But
if you're referring to those who are post-graduation,
yes.
Then when they come on board, what is always important is to understand what training objectives they come with. For example, if someone were to come as a PharmD graduate,
okay,
or someone who comes for specialty, rotation, or clerkship, then we put them through specific supervisors or preceptors.
Doctors are acting as a preceptors, or only the pharmacists are focusing as a preceptor in Singapore?
Yeah. If they are pharmacists, then they come under pharmacists for preceptorship.
Okay.
Yeah, so we also have residencies, example, infectious disease residency, oncology residency, and critical care. So for these, right, they are very specific one-year program. There would be a program director with, the faculty members who will then run this program.
Okay, last question. Before that pre-registration for clinical posting, students are exposing anything with community pharmacy postings?
Repeat that again?
Before this clinical postings, right? Because this is a 1-year posting, 3 and 6 months, 6 months. This is a clinical. I'm asking, your students are exposing any community posting, community pharmacy posting before their completion of graduations?
Okay, so the original program was that they will be exposed to hospital and retail pharmacy 6 weeks each during their student days. But this program will be changed by 2017. They will be doing this as a 3 months rotation in course during the student days, and then there'll be another 3 months rotation, 2 of that post-course.
Okay, yeah, almost similar. Thank you very much.
So, any further questions? Thank you very much.